we have to study now the posterior axioappendicular muscles. It includes the first, second, and the third layers, and the first layer is the superficial layer of the muscles called as extrinsic shoulder muscles. And in this list, you will study the trapezius on both sides and the latissimus dorsi. We will study them one by one. Now concentrate on the trapezius muscle. It gets its origin from the superior knuckle lines, right, and the external occipital protuberance. Then there lies the ligamentum knucki, and then you get the supraspinous ligament in the related vertebrae and their spines in between. So on their way, it gets origin from the C7 spine, right, and from that T1 to T12, right, thoracic 12 spines. So these are the parts from where it gets origin and on both sides, and finally it has to move laterally, and where now it gets inserted. If you can recall, this is the place where it gets attached on the posterior border of lateral 1/3 of the clavicle, right? If you can observe it, right? Okay. Now, along with it, it's get inserted on the upper lip of the crest of spine of scapula, right? And covering the medial portion of the acromion process. So this is how it's being completed on both sides, right? Now about the latissimus dorsi, right? Let me enlarge the view a little bit more to show you the latissimus dorsi. This muscle takes origin from the, if I can take the help of the pencil, it will be taking origin from the posterior 1/3 of the outer lip of the iliac crest on both sides. You can see, and along with the lumbar fascia that attached the muscles of your lumbar region and of course the sacral spines, right? And in the way it has to get origin from the T7, right? T7 to T12 spines, right? Means thoracic spines. And in between, it is also getting attached to the lower foreribs on both sides, right? These are the places from where it has to get its origin. And never forget, if I draw the scapula here, it also originates from the inferior angle of the scapula, right? Dorsi. Now, if I have to rotate a little bit, you will observe that this muscle is getting attached just below this deltoid under the fibers of it in the intertubercular groove, its floor, right? So this is how we complete the latissimus dorsi muscle on both sides, right? Now, after removing the superficial layer, we have to learn about the deep-seated extrinsic shoulder muscles called as deep posterior axioappendicular muscles. Now we will see among these the levator scapulae, right? This levator scapulae is going to be originated from the spines along with their transverse processes of the C1, C2, C3 and C4 vertebrae, right? And it is coming and is inserting on that. Let me mark not the muscles but this with the help of a pen. You can see it is getting inserted on the superior angle and upper part of the medial border of the scapula. Can you see that? Okay. Now I have to show you there is another muscle next to it is the rhomboides minor. This rhomboides minor takes origin from the spine of C7 vertebrae and T1 and is attaching, as you can see, on the base or the triangular area at the root of the spine. Can you see that? This is the area. And if we see that this whole muscle is the rhomboides major, this whole one, and it is getting insertion again along the medial border in the third layer or the intrinsic shoulder muscles, which are also known as scapulohumeral muscles. We learn about this bulky muscles including deltoid on both sides, and the teres major muscle. And of course, if you can recall, there were 4 rotator cuff muscles and we abbreviate them as SIDS. Let me repeat their names: the supraspinatus, infraspinatus, teres minor, and subscapularis. Okay. Now see, this is the rhomboides major. It takes origin from the spine of T2, 3, 4 and 5, right? And intervening supraspinous ligaments are there, right? And is getting insertion. If you can see, this is the medial border of scapula just below the root of the spine, right? This is how it gets its insertion. Okay. Now after that we have to learn about the deepest you would say, or the lateral aspect of this. But before going to the detail, have a look on this deltoid muscle. This deltoid muscle, as you can see, is attached on the low margin or the crest of the spine of the scapula. It's low margin, right? As you can see it. Now if I rotate it laterally, you can well observe still we are looking into this deltoid muscle and is being attached on the low border of the acromion process. That was the lower margin of the spine of scapula, and now coming towards the acromion process. And now if I turn it entirely, now you can see that it is attaching on the lateral 1/3 of the clavicle. These all are the places from where it gets its origin, and this is the place which is the deltoid tuberosity over the humerus where it is inserting. So this is a bulky muscle, you can see very well. Now you can see I have to remove this, and now let me enlarge and you can observe the supraspinatus muscle. This supraspinatus muscle is located in the supraspinous fossa. So medial 2/3 of this fossa is giving origin to it, right? And if you can see, it is going towards the humerus on the upper impression of the greater tubercle of the humerus. Okay. Now see, this is the infraspinatus, of course, again in the medial 2/3 of this fossa, and gets insertion on the middle impression of the greater tubercle of the humerus. As you can see, if I can cut this deltoid, now you are looking very clearly that this is getting insertion. This was the infraspinatus and this was the, below it is the teres minor. Now teres minor, from where it is taking its origin, this teres minor is getting origin from the upper 2/3 of the lateral border of the scapula, and now again it's inserting on the lowest impression of the greater tubercle of the humerus. So this rotator cuff has included this supraspinatus, infraspinatus and the teres minor. That was the scapula. Above that is the supraspinatus, this is infra, and this is the teres minor. And now we are left with the subscapularis. If you see the ventral aspect of this scapula which I have bisected, and you can see this subscapularis, that is getting origin from the medial 2/3 of the subscapular fossa, and if you concentrate, it is going to get insertion on the lesser tubercle of the humerus, right?